Hi class, this is video 12, and in video 12 we're looking at the spine and the rib cage. So this means that we are, for the time being, leaving the bones or leaving the muscles of the upper extremity. We've completed that portion of the class, and now we're moving on to the bones of the spine and the rib cage. And once we cover that, then we'll move into muscles in this area, even though we've gotten some muscles in this area already. Okay, so let's take a look at the spine. Here's the spine. Okay, what do we need to know about the spine? We know the parts of the spine. There's a bunch of stuff you already know. So you know that through the neck region, this is the cervical spine. Through the middle part of the spine where the rib cage is, that's the thoracic spine. And the low back region down here is the lumbar spine. Below that we have the sacrum and we have the coccyx. So that, I think you already knew all that. And I think you already know how many bones are in each section of the spine. So cervical spine, how many? You knew it. 7. Thoracic spine, how many? 12. Lumbar spine, how many vertebra? 5 vertebra. Sacrum and coccyx are a little bit strange, right? Okay, because the sacrum is, there's one sacrum, there's one coccyx, but they're formed out of fused vertebra. And so the sacrum is formed out of 5 fused vertebrae. So we do talk about sacral segments 1 through 5. So S1, S2, S3, S4, S5. But it fuses around the age of 20. Most of us have our sacrum fused, and it's fused into one bone. So in our teen years and in our childhood years, it is not yet fused, and these are separate bones. So anyway, so there's one sacrum made out of 5 segments. There is one coccyx made out of 2 to 4 segments. So it's not the same on everyone. But this model actually shows 4 coccygeal segments. 1, 2, 3, 4. Okay, so 4 coccygeal segments. So that's abbreviated CO to different, so CO1, where am I here? CO1, CO2, CO3, CO4, to differentiate it from the cervical spine, which is C1 through C7, etc. Okay. So curves of the spine. Let's look at these curves. So you can see that there are curves to the spine, right? It is not a solid, straight thing. Now, this is a model. On a living person, we probably actually would see a little more curvature on some people, on a healthy spine. But let's talk about these curves. So there are primary curves and secondary curves. First, let's talk about why do we have curves in the spine. One key reason we have curves is for shock absorption. So when we're moving around, we're jumping, we're running, we're playing, we're skipping, whatever, and we're moving, and every movement that we make, there's some jarring that happens in the body. The curves of the spine can absorb that shock. So like a spring, in a way, they absorb that shock. So we have curves as a shock absorption, to absorb shock. Also, they absorb shock, and then they kind of spring back up too. So they do help to kind of move us along also. And also, curves are important. We find curves throughout the body because curves are actually stronger than straight lines. So in nature, the strongest shape in nature is an arch. And we find arches throughout the body, and curves are reminiscent of arches. So there's actually quite a lot of strength in a curve. And so that's another reason that we have curves in the spine. So both to absorb shock and also to provide strength. So the curves of the spine we can separate into different sections. So we have primary curves and secondary curves. The primary curves are the curves that we had at birth. So when we're first born, our spine is curved in one kind of C-shaped curve. That shape is still reflected here in the thoracic spine and here in the sacral and coccygeal spine. So those are our primary curves. So the primary curves are kyphotic curves. So a kyphosis is a curve in which the spine curves like this. So it's concave. If you're looking at it anteriorly, you would say it's concave. If you're looking at it posteriorly, you would say it's convex. So, but it's a curve, like a shape like this. Those are the primary curves in the thoracic region and in the sacrum and coccyx. So those are the curves that are kyphotic. So that term is, I'm not sure if I have that in your notes. I don't think I do. So kyphosis is Kyphosis, kyphosis. So kyphotic curves there and there. And then secondary curves are curves that develop over time. They develop throughout our first year of life. So when we're first born, we just have this C-shaped spine. And then as we start gaining the strength and in our first few weeks and months of life, and we're able to hold up the head, we develop the the cervical curvature. And then as we're able to sit and stand, we develop the lumbar curvature. So the curve in the lumbar spine and the curve in the cervical spine are considered secondary curves because we develop them later in life. And they are lordotic curves. So that those types of curves are a lordosis, Lordsis, lordosis. And so they are concave anteriorly, convex posteriorly. Wait, did I say that correctly? They are I said it backwards. They're convex anteriorly, concave posteriorly. So, and you can see it more clearly in this model in the lumbar spine. So this is a lordosis. So it's convex anteriorly, is concave posteriorly. So that's normal curvature. It's not uncommon to see abnormal curvature in the spine where either the lumbar spine is flattened. And so what we're going to see throughout the spine with abnormalities is they'll be reflected usually in different places of the spine. So the lumbar spine and the cervical spine will reflect each other, and the thoracic spine and the sacrum and coccyx will reflect each other because they have the same types of curves there. So where people tend to have problems more commonly is lumbar and cervical curves. And so the normal curve in the lumbar region and in the cervical region is called a lordosis. If that curve is exaggerated, it's still called a lordosis. And so, it's kind of strange that the pathological term for it is the same as the regular term for it. But you might say that somebody has an exaggerated lordosis in their lumbar spine if it's, like this, which would be this exaggerated anterior pelvic tilt. And curves can be abnormal in other ways as well, but, so they can be exaggerated or they can be flattened. And there can be abnormal lateral curvature to the spine, which I don't know if I can make this. I don't think I can make this model do it, but the spine can have lateral curvature to it too, which can be a C shape or can be an S shape. But abnormal lateral curvature to the spine is not terribly uncommon. That's called a scoliosis. So the normal curves of the spine are lordosis and kyphosis. Lordosis in the cervical spine and the lumbar spine, kyphosis in the thoracic spine and in the sacrum and coccyx. Abnormal curvature is scoliosis, which can occur anywhere in the spine. Okay, so those are our curves and our number of bones in each section. Let's look at the let's see here. Let's look at just name the bones of the rib cage here, and then we'll go into the vertebra specifically. So the bones of the rib cage are the sternum. So the sternum has three parts to it. The manubrium is this top part here. The body is this middle part, and the xiphoid process is this lower part. The xiphoid process you're probably familiar with because we palpate that often to find some of these lower Ren points, because we might count down from a certain number of Sun down from the tip of the xiphoid process. But not everyone has a palpable xiphoid process. Everyone should have it, but on some people it tips posteriorly so much that you can't palpate it. In which case, but you should still be able to palpate this where the ribs come together, and then you can do your counting from there. But the xiphoid process is, you know, in a lot of books, that's where you see counting down those Ren points from there. So xiphoid process, body of the sternum, manubrium of the sternum. So the manubrium is where the clavicles articulate with the sternum, and the manubrium is where ribs 1 and 2 articulate, and then the body is where ribs 2, so rib 2 articulates right here where the manubrium, this is the angle of the sternum here. And where the manubrium and the body come together, that's where rib 2 articulates with the sternum. And then 3, 4, 5, 6, and 7 all articulate with the body of the vertebra. And those are our true ribs. Ribs 1 through 7 are the true ribs, meaning that they all have direct attachment to the sternum. And then down from 7, we have 8, 9, and 10 are considered false ribs, although there's nothing terribly false about them. The only thing, why they're considered false, so actually 8, 9, and 10, and 11 and 12, these two are all false ribs, to contrast them with the true ribs 1 through 7. So what's false about these is they don't directly articulate with the sternum, but you can see that 8, 9, and 10 do articulate. So they have articular cartilage or costal cartilage. So costal is a term that means rib, or refers to ribs. So the costal cartilage of 8, 9, and 10 connect with the costal cartilage of rib 7. So those do indirectly attach to the sternum, but they don't directly attach. It's just through the costal cartilage of rib 7 that they attach. So those are false ribs. And ribs 11 and 12 are also false ribs. They do not articulate with the sternum, and they don't even have costal cartilage. And so those two, 11 and 12, are called floating ribs. Can you see them? So there's 12, and here is 11. And we use those, we're going to palpate those too, right, to find points in that area. So there's rib 12, and there is rib 11. So the tips of those are usually palpable, sometimes hard to find, but they should be palpable on people. Okay, so those are the floating ribs. 8, 9, and 10 are false ribs. 11 and 12 are also false, but also floating. And then 1 through 7 are true ribs. 11 and 12 are the only two that don't have costal cartilage. All the rest have costal cartilage, where they articulate with the sternum. It's just that 8, 9, and 10 have their costal cartilage feeding right into the costal cartilage of rib 7. Okay, so that's the rib cage. We'll take a closer look at an individual rib in a minute, but let's first take a closer look at individual vertebra. So first, let me show you a single vertebra. We're going to name a bunch of parts here on this single vertebra. So if we look at this, we should be able to tell what part of the spine it's from if we know the differences between the vertebra in the different parts of the spine. So if we look at this one, I will just tell you, oops, that I dropped it, that this is a lumbar spine. And I know it because, or part of the lumbar spine, it's a lumbar vertebra. And I know that because it has a short, square spinous process. And that's one of the features of a lumbar spine. And it's got a pretty good sized body, so, but not as big as the bodies will get in the lower lumbar. So this is one of the upper lumbar vertebra, so maybe L1 or L2. Okay, so, but let's take a look at all of the parts on this vertebra, and then we'll go through the parts of the spine and take a look at how they look a little different in the different parts of the spine. All right, so let's name these parts here. So if this vertebra is sitting in the body, this is the posterior side of the body. This is anterior, but like, you know, the abdomen is in front of this, right? So here's the front of the body here, and all the guts and stuff, and then here's the spine. Here's this where the spinal cord runs, and then this is the back. So you can palpate these spinous processes in the posterior part. You can reach back there right now and feel your spinous processes. They're easy to palpate, and we'll do lots and lots of counting of those spinous processes to see where we are in the spine. spine to find certain acupuncture points. So this process right here is called the spinous process. Palpable throughout most of the spine, but most of the spinous processes you can palpate. So spinous process, that's our first part of the spine, or of the vertebra that we're learning, the spinous process. And we've already seen muscles attaching to it, so we've already talked about the spinous processes. Okay, so that's the spinous process. Then laterally we have transverse processes. So here and here are the transverse processes. So if we look from above, here and here, those are the transverse processes. So a spinous process, and then transverse processes that are lateral and anterior to the spinous process. In between those, there's a stretch of bone called the lamina. So this stretch of bone right in through here is called a lamina, on this side and on this side. You maybe have heard of a procedure called a laminectomy, which is the removal of a lamina, which is what they'll do sometimes in the case of a herniated disc. So we have spinous process, we have lamina, we have transverse process. The lamina, when we line them all up, we get this nice kind of groove that's created here. So right in through here is called the lamina groove. And so that's this groove between the spinous processes and the transverse processes. The deep interspinal, or the deep paraspinal muscles, deep paraspinal muscles fill up that groove. And this groove is, and near here too, this is where the erector muscles are. But there's a groove that you can palpate. You can palpate the spinous process, and then there's a mound of muscle on either side, moving away from the spinous process laterally when you're palpating somebody's back. And much of that muscle is muscle that's in that lamina groove. All right, so what else do we have here? We have a couple of facets. So this is and processes. So this is the superior articular process, here and here, superior articular process, and then down here and here we have the inferior articular process. So each of these processes also have facets on them. Remember that a facet is a flat surface. So like the word face comes from that term facet, like the face of a clock or our own face. So a facet is a smooth, round, flat surface. So there's a facet here on the superior articular process, and then there's a facet back here. Can you see it? Here, you can see this one, on the inferior articular process. And so what happens with those facets is when we stack all the vertebrae together, the facets come together. So you can imagine how this facet on the vertebra below here would articulate down here with this facet, right? And so, and that creates what are called the facet joints in the spine. So let's see if we can see a facet joint. So this spine is hard for me to move it very much, so I can't open it up and show you very well, but I think you can see where these facets come together. So here's an inferior articular facet, here's a superior articular facet, process. An inferior articular process, a superior articular process, and where they face each other and where they come together, that's a facet, and that forms a facet joint. So we're going to have facet joints associated with each neighboring pair of vertebra. Okay, those are the facet joints. And then the other joint, while we're talking about joints, that we have in the spine are the joints that are formed between the bodies of neighboring vertebra. So between the bodies, we didn't get to that part on here yet, but I'm assuming you already know that that's the body, that big kind of round, flat, the main bony part of it. That's the body of the vertebra. Okay, that's like a whole lot of the structure of the vertebra is right there. So here, this is the body of the vertebra, and between the bodies are intervertebral discs. And so this joint here is called the disc joint, and it's formed between the neighboring bodies and, with the disc in between. So let's just take a minute and talk about these intervertebral discs. I don't have a model of a disc with me, but these discs, you can imagine them like they are the shape of the bodies, so we can see the shape of this body here. So that's the shape of the disc, and then they're kind of like a jelly donut in that they have a certain structure on the outside of them and then a different structure on the inside of them. So on the outside is a fibrous structure called the annulus fibrosus. So we have that word part fibrosis that indicates that it's made out of strong fibers, and then the inside part is called the nucleus pulposus. So nucleus referring to like the center of it, and pulposus referring to the quality that it's like a pulpy. It's more gelatinous than the outer part, and so it's kind of like, do you remember those shoes in the 90s? Those well, they're kind of like the Air Jordan shoes, you know, with a pocket of air, but I think they made gel shoes like that too, right? With like a gel thing. And, you know, so anyway, the discs, very much like the curves of the spine, are there for shock absorption. So they, you know, as we move and bounce and jump and play, they absorb shock, you know, that happens each time we impact the ground. And so they're there for shock absorption. They're there to make the vertebra articulate and fit together correctly. But you know, something that's interesting about the discs is they do not have a blood supply of their own, and so you know, we want the discs to be juicy, right, and to not be flattened. But you'll see you can go online and, you know, look at lots of X-rays where the discs are very flattened. And, you know, they say, I've never done this experiment myself, but they say that you can lose as much of a half inch of height throughout the day. So if you measure your height when you first get up in the morning, when your discs are all hydrated and you've been laying down, so your spine isn't, you know, up in gravity and you know, creating pressure on the discs all day, that you're a certain height. And then if you're standing and sitting all day and up in gravity, that a certain amount of compression happens, and compression throughout the entire spine can equal as much as a half inch of difference in your height by the end of the day. So that's what they say. You can do that. You can measure it, find out, tell me, text me, email me. Right here they're showing, in this model, they're showing a herniated disc. So what a herniated disc is when tears develop in the annulus fibrosus and that nucleus pulposus bulges out. And sometimes it stays connected and bulges out, or sometimes it comes all the way out and disconnects with the rest of the disc. But always when it's bulging out, almost always, it's going to put pressure on some nerves in this area, and that is going to create pain. And that is something that actually acupuncture is really good at treating. But, you know, and this can take care of itself on its own. I don't know how well you can see it. You can see that bulging disc there, or herniated disc. So if somebody if that happens to somebody and they take time and they are off their feet for a number of days, and, you know, allow that that herniated part to go back in, and if there's not too much tension in the muscles around the spine, it completely can take care of itself. But they do also sometimes do surgery for this, fairly often actually, because either there's too much tension on the spine and it isn't going back in, or the pain is too severe and there's too much pressure on the nerve and they're unable to kind of get into any sort of place of comfort at all. So anyway, so that's not an uncommon surgery that happens for back pain. All right, I feel like I'm digressing. Okay, so we've talked about the joints of the spine, so the facet joints and the disc joints. So those are the joints that we have associated with the spine. We will review the movements of the spine, but I know you remember those. And, okay, a couple of other features of the vertebra. Let's go back to the vertebra. That's why I feel like I'm digressing, because we haven't finished all this yet. Spinous process, lamina groove, transverse process, superior articular process, inferior articular process. Each of those has a facet where they meet each other on the neighboring vertebra. Vertebral foramen. See that hole? That's the vertebral foramen. When we line up all the vertebral foramen in the spine, we have what's called the vertebral canal. And the vertebral canal houses the spinal cord. Okay, so that's where the spinal cord lives, where it runs through the spine. And then we have the body of the vertebra. So remember, this orients like this. Okay, so see how this is like this. So so the spinous process is posterior, the body of the vertebra is anterior, and then really like quite in the middle of the vertebra itself is where the spinal cord runs. And so, part of the job of the vertebra is to protect the spinal cord that runs, through it. So that's one. Oh, I just realized this is L1. I'll show you what I just saw on here that made me realize that I know which vertebra this is. It's L1. But hold on. Okay, so I was talking about the canal, the vertebral. Oh, I was going to talk about other foramen. So this is called the vertebral foramen when we're just looking at it on one vertebra. When we line them all up and it creates a canal, then it's called the spinal canal or the vertebral canal, and that's where the spinal cord hangs out. But there are other holes, other foramina in the spine, but you can't see any other holes here, right? There's only one hole in this vertebra. So where are the other holes? The other holes form when we bring neighboring vertebrae together. So where we have let's see here. Okay, so here is a superior articular process of one vertebra. Here is the inferior articular process of the neighboring vertebra. And I hope that you can see this okay, but there's an arch right here in this superior vertebra and an arch right here in the inferior vertebra. When those two arches come together, they form a hole. See that hole? It's hard to see because the nerve is there. But anyway, there's the hole. There you can see it better if I get the nerve out of the way. That's called the intervertebral foramina, or foramen. So a single hole, it's called a foramen, and if we make that word plural, it's foramina. So all along the spine, we have intravertebral foramina. So intravertebral, meaning between two vertebrae, intervertebral, between two vertebrae, and then foramina, meaning hole, or foramen, meaning hole. And so those are the holes where the spinal nerves come out of the spine. So the spinal cord is in here, in the vertebral foramen, or in that spinal canal, and then between each neighboring pair of vertebrae, there's a hole that's formed between two of them, and then the spinal nerves come out those holes. Okay, so let's see. And so in this model, we can see all those spinal nerves. That's what these kind of rubbery things are the spinal nerves. All right, so now let's go back through the different parts of the spine and recall these parts that we just labeled on here, but let's find them on the different areas because they're going to look a little different in the different regions of the spine. So starting with the cervical spine. Now the cervical spine is different in so many ways. Remember, nobody has this. This is just part of the model, that rod. Although sometimes with severe scoliosis and severe, pathogenic kyphosis and stuff, sometimes they do put a rod in the spine. But, anyway, okay. So the first two vertebrae are especially unique, and so unique that we do call them C1 and C2, and this is C3, C4, C5, C6, and C7. So C7 is the first of the prominent spinous processes in the cervical vertebra, so it's difficult to palpate spinous processes until we get to C7. And then T1 is more prominent than C7 and is pretty easy to palpate. And so T1 here, T1 I believe is the one that's called all yang. And so this is the region where all the yang channels converge. Okay, so let's talk about C1 and C2. So C1 has a special name, and it is the axis, A-X-I-S. It's the axis. And so you can think of that, oh, sorry, I said it wrong. It's the atlas, A-T-L-A-S, atlas. Sorry. I have a foggy brain from allergies. Okay, so this is the atlas. So it gets its name Atlas from the Greek god Atlas by the same name. The Greek god Atlas is the god who holds up the world, and so that's where this name Atlas comes from, because this vertebra holds up the world. What is the world? It's the head. So so the head articulates with the spine there at C1, or at the Atlas. So can you see that this is a really different looking vertebra here? It does not have a body. Can we see it? There it is there. It does not have a body. Oh, which would be here. It does not have a body, and it does not have a spinous process, but it does have really big, wide transverse processes. So instead of, so the anterior part of the vertebra here, this is called the anterior arch, and this posterior part back here is called the posterior arch. And where a spinous process would be is the posterior tubercle. So there's not even a spinous process on C1. It's the posterior tubercle. So one of the things you can notice by looking at C1 is there's a special feature in the cervical vertebra. In their transverse processes, there's another hole. So this is called the transverse foramen. So this transverse foramen houses a blood vessel called the vertebral artery. So the vertebral artery runs through here, and so it running through the transverse processes of the cervical vertebra is just another layer of protection for that blood vessel that's running up to the brain. Okay, so this is the Atlas. This is C1. So no spinous process, just a posterior tubercle. We have a posterior arch back here. We have transverse processes that are quite wide. We have an anterior arch here that just sort of has this kind of thicker area where the body would be. So it's really big here. It's almost just like a ring of bone, right? And so it being a ring of bone means that it has a huge vertebral foramen. And it needs to have a huge vertebral foramen because up at the top of the spine, that's where the spinal cord is the biggest. And as we go down the spinal cord gets smaller and smaller because we have spinal nerves coming out of it. So, tissue of the spinal cord is continuous with and becomes nerves that go out to the body. So the spinal cord is quite thin at the lower part of the spine and quite thick at the upper part of the spine. So we need to have a really large vertebral foramen on C1 and all of the cervical vertebra. There are also facets here on C1. And these facets receive, I don't have the skull out here with me, but they receive the condyles, which are a landmark on the occiput. So the occiput articulates with C1. And it forms the atlanto-occipital joint, which is abbreviated the AO joint. And at that AO joint, flexion and extension happen. Okay, so flexion and extension just right there between the occiput and C1. And then, now let's look at C2. So C2 also is unique. It does have a body and it does have a spinous process. Let's see if I don't know if I can lift C1 up enough for you to see this. We might have to rely on pictures. Anyway, okay, I will just tell you, I hope you can see it. So if I kind of try to get C1 out of the way here, sticking up off the body of C2 is a little stretch of bone that's called the dens. And it's kind of like, the dens is sort of like this little thumb sticking up off of, maybe from the top, I don't know. I still don't see it very well because there's a screw coming out of it to hold the model together. But there's a bone, an extension of bone coming up out of, off of the body of C2. So that's called the dens. That's the special feature of C2. C2 is the one that's called the axis, because that dens is like the axis of rotation, not like it is the axis of rotation. And so a rotation action happens there between C1 and C2. That joint between C1 and C2 is called the atlantoaxial joint. It's abbreviated the AA joint. And the AA joint rotation happens there, whereas the AO joint between the atlas and the occiput, flexion and extension happens there. And then at the AA joint, atlantoaxial joint, rotation occurs, and that rotation happens around the dens of C2. So if we go down from there, other special features. So in general, the bodies of the cervical vertebra are smaller, and bodies of all of the vertebrae get larger as we go down the spine. So the bodies are smaller through here. We already talked about the special feature of the transverse processes, that they have a hole in them, a foramina, or foramina is the plural, I should say. So each one has a foramen. And then we also see, we don't see it on all of them on this model, but many cervical vertebrae have a split. It's called a bifid spinous process. So see how that spinous process splits there? It's forked like the tongue of a snake. And that's just to provide more surface area for muscle attachment, because there's so many muscles that need to attach to these small vertebrae up here. So, okay, so that's it for the special features of the cervical vertebra. So of course there's no disc here either between C1 and C2, because there's no body of C1 doesn't have a body, C2 has a dens. There's no place there for a disc. So the discs pick up here between C2 and C3. All right, so then moving on to the thoracic spine. So the thoracic spine is less mobile than the cervical spine and the lumbar spine. So the cervical spine needs to be very mobile, and because on top of the cervical spine is the head, so it needs to be both strong and mobile, because it has to be able to move the head around so that we can move our sense organs around, so we can, align our ears and our eyes with things that we're hearing, things that we're seeing, align our nose with things that we're smelling, be aware of our surroundings. So the cervical spine is quite mobile. The thoracic spine is not mobile, and it's because the thoracic spine, not that it's not mobile at all, but it's far less mobile than the cervical spine, because the rib cage attaches to the thoracic spine. So that's essentially the unique feature of the cervical, or of the thoracic spine, is the presence of the rib cage and the articulation places for the ribs. So the ribs articulate. Oh, well, let me say this too. So of course I already mentioned that the bodies of the vertebrae are getting larger and larger as we go down. If we look at the spinous processes through the thoracic spine, what we notice is up here at T1, the spinous process is pretty straight out, but then right away at C2, C3, C4, these spinous processes start their downward slope. So there are these long downward sloping spinous processes. And again, if I could open this up, I guess you can kind of see this one. It is said that spinous processes, that thoracic vertebra look like a giraffe. If you can see this guy, you maybe can notice a giraffe's face there. Okay, so they have long downward sloping spinous processes. So they slope down so much that they become level with the body of the vertebra below it. So it's a long downward sloping spinous process in the cervical or in the thoracic spine. So other features of the thoracic spine are the facets for the rib articulation. So the ribs articulate the head of the rib. We haven't talked about the parts of the rib, but heck, let's throw that in here because it's part of this video. The head of the rib articulates with the body of the vertebra. So each rib, on the vertebral end of the rib, there is a part of the rib that's called the head. So the head has two facets on it, and those facets articulate with two neighboring vertebrae. I'm trying to see if there's one that you can see really well. I don't know. I think we might have to rely on pictures for some of this too, because it's hard to see here. But anyway, so the heads articulate with the bodies of the vertebra, and then if we go away from the head of the rib, there's the neck, but then there's a tubercle, which you might be able to see here. Let's see if I can point out a tubercle. So that bump right there, that's the tubercle of the rib. There's a bump. There, those are the tubercles. So there, in that area, there is also a facet, and those facets articulate with a facet on the transverse process of the thoracic vertebra. So special features on the thoracic vertebra include all of the facets for rib articulation. So there are facets on the bodies, and there are facets on the transverse processes for rib articulation. So there are far more joints in the thoracic spine than there are in the rest of the spine because of the rib articulation that happens there. Okay, so so now let me show you how I figured out that this was L1, because on the top part of the body here is a facet. So that facet is where the head of rib 12 is articulating, partly with this vertebra and then partly with T12, which is above it. So that's how I know that this vertebra is L1. So the lumbar spine, where the cervical spine were all about mobility, yet, strength to support the head, the lumbar spine are all about support and strength. And so you can see they are much bulkier vertebra for that purpose. So they're supporting all of the weight of the upper body. And so they're much denser, much thicker, much sturdier bones. And so, in the lumbar spine, we're back to that trade-off between, we need it to be quite strong and quite stable, but we do also want it to be mobile. And so we have to find kind of that perfect, sweet spot between mobility and strength in the lumbar spine. And we know, what's the number one reason people seek out acupuncture? Low back pain. So we know that stuff happens to the low back, unfortunately. Okay, features of the low back, of the lumbar spine. Large bodies, nice, bulky bodies, short, square spinous processes. The transverse processes are not very big. They're kind of thinner transverse processes. And that's it. It's about it's mostly the size that's kind of different about the lumbar spine. No special facets, not a huge amount of mobility because we do want to have stability, but more mobility than the thoracic spine. The sacrum, the sacral spine. So again, like I said before, this fuses around the age of 20. So before that, these are our separate vertebra. Let's see, what special features? There are a lot of special features of the sacrum, actually. So you can see, looking at the sacrum, you can see remnants of all of these parts of the vertebra that we talked about. But here, it's just this like median sacral crest, which is this raised part down the middle of the sacrum. Here, that used to be spinous processes, but now this is all fused. You can see those bumps, and we're going to palpate. We palpate the sacrum a lot because we want to find these foramina. So there are sacral foramina here, which are the remnants of the intervertebral foramina throughout the spine. And these sacral foramina, holding true to the function of the intervertebral foramina, have spinal nerves coming out of them. The sacrum has this surface here that's called the auricular surface. It's called auricular because it's supposed to look like an ear. So that auricular surface articulates with the pelvis, and that is where the weight of the upper body gets conveyed onto the pelvic girdle, which then conveys the weight onto the lower body. So the sacrum articulates with the ilium. and at the posterior iliac crest. And the ilium has a similar shape. So this auricular surface that we see on the sacrum, we also have an auricular surface on the ilium, and the two of those come together to form the sacroiliac joint. And then, and as we go down, we kind of lose features more and more, so that each of the coccygeal segments, by the time we get down to the fourth coccygeal segment, it really is just like a little ball of bone. But the top coccygeal segment, we can see, what would be transverse processes. We can, kind of see what would be, well, on the anterior side, we can see what would be bodies, what would be a body, but it's all, much flatter, and most of those features are not something that we can see so much by the time we're done in that part of the spine. Okay, so let me just see what else we haven't talked about here. Oh, the angle of the rib. One other feature of the rib is the angle of the rib, which is this corner in through here. So the ribs are actually quite flat through this area, but it kind of turns a corner to head back toward the spine, and that's the angle of the rib. So the ribs have a body, a neck, a tubercle, an angle, and then, oh, sorry, I said body. Head. Head is the part that articulates with the spine. Head, neck, tubercle, angle. This is the body of the rib here, which is flatter than you might expect it to be, but is fairly flat. And then, but there's an angle back here where it kind of turns toward the spine. Okay, let's review movements of the spine. And rib cage. So let's start with the rib cage. The rib cage is pretty easy. The only movement associated with the rib cage is the movement of the ribs. So with a big, deep inhalation, the ribs will all expand away from each other, and with a strong, forced exhalation, the ribs will like all compress toward each other. So basically, the movements of the ribs are elevation and depression. But the result is an expansion of the rib cage and a compression of the rib cage. But if we look at any individual rib, we can say, oh, that rib is elevating or that rib is depressing. So elevation and depression are the movements that the ribs can do. The rest of the spine, the movements that happen there, I'll just demonstrate them in the neck, but they happen throughout the whole spine more or less. More in some areas and less in other areas. So flexion, extension, hyperextension, those are all normal parts, movements of the spine. Lateral flexion, so that happens in the neck, but it happens throughout the entire spine. Rotation, and when we're just talking about movement of the spine, we don't have to say this is an ipsilateral rotation or a contralateral rotation. We're just saying it's a rotation. This is a movement that happens at these joints. It's a rotation. But when we're talking about muscles, that's when we would go, what kind of rotation does this muscle create? Oh, it creates an ipsilateral rotation, meaning it pulls the spine to face the side of the contracting muscle. Or it does a contralateral rotation. It pulls the spine to face away from the contracting muscle. So, but the spine itself, movements that it does, just rotation is all that we need to call it. So flexion, extension, and hyperextension is part of a normal range of motion of the spine. Lateral flexion and rotation. That's what the spine does. Okay, so let's just look at our objectives here briefly, and make sure we covered everything. So parts of the spine, curves of the spine, number of bones in each section, special features of each section, bones of the rib cage, and we also talked about, and then the features of the vertebra, and they're all listed in your notes here. And the parts of a rib. Oh, vertebral end and sternal end. I didn't say that. Hopefully that's pretty obvious. The sternal end of the rib is the end closer to the sternum. So down here is the sternal end of the rib, and the vertebral end of the rib is back here, where it articulates with the spine. So I guess one other feature of the ribs here is at the sternal end, the bony part ends and this becomes cartilage, and so this is called costal cartilage. On this model, there's a line there, but on some model, and this one is actually broken, so you can really see the difference between the rib and the cartilage. But on some models, the cartilage is made out of a different material or it's a different color, so you can really see the difference. But all along here is where that separation is between the costal cartilage and the ribs themselves. So costal cartilage is also something you should know, but this is the sternal end of the rib, this is the vertebral end of the rib. We talked about the head, the neck, the tubercle, and the angle of the ribs. We also talked about where the facets are on the ribs. And the joints of the spine, we talked about the facet joints and the disc joints, and we talked about the movements that happen throughout the spine. So that looks like that is video 12. Let me show you what our special word is, if he's still around here. Time out. Let me find him. Here he is. This is Timothy. He's a Sonoran Desert tortoise, but I thought he was appropriate for the video on the spine because their shells, look at his cool shell. Hey, Timothy. See these, each of these segments of his shell are, these are all attached to his spine. And, it's just a cool feature of a tortoise. Anyway, so tortoise is our word for this video. Tortoise, T-O-R-T-O, wait, how do you spell tortoise? T-O-R-T-O-I-S-E, tortoise. Yeah, that's how you spell it. Okay, that's Timothy, or you could just say Timothy, but Timothy the tortoise. All right, so we've got a midterm coming up. Look for midterm review material and more info on that in class on Friday. Okay, thanks guys. See you next video.